It takes more than just an apple a day to keep the doctor away. Shape up with Body and Soul.
938 Live.
Welcome into Body and Soul on 938 Live. Daniel Martin here. It is time for your ongoing series, the Chlorella series, right here on Body and Soul. We've learned all about this wonderful superfood, which is one of nature's powerhouses. We've discovered how, supplements play a role in your diet, but this is not really a supplement because it's a naturally occurring algae, but it does provide you wonderful powerhouse benefits from antioxidants and more, including the Chlorella growth factor, which you've heard about in the past as well. Well, the series continues. Last week we talked about how it has a role to play in hypertension. Today, how about diabetes? What role does Chlorella have to play in the management of diabetes? We're going to find out with Associate Professor Haresh Kumar, who is from the Faculty of Medicine at Masa University College in KL, Malaysia. He has a background in the areas of research in microbiology, medical science, and nutrition. This edition of Body and Soul brought to you by abeilledor Chlorella. For more information, please call 6339 5045. That's 6339 5045. Dr. Haresh, welcome back to the program. Thank you for joining us today.
Good morning. Good morning, Singapore.
Yes, indeed. You're joining us once again live. So I want to remind my listeners that if you have any questions, you can call through. You've had so many questions these last few series, and we really appreciated them. We'll try and put through as many as possible. 669-11938 is the number you can call through to right now. Dr. Haresh, let's talk a little bit about this. Diabetes, we hear, is really going to be one of the big problems in the next 15-20 years. WHO has called it the next epidemic in some cases. Talk to us about the prevalence of diabetes in Singapore, for instance.
Now, at the moment, Singapore has as we know, the diabetes is quite common in Singapore. Now, basically, 8.6% of the population in Singapore is affected, with diabetes mellitus. It used to be 4.7%.
Look at that.
1984. Today it's doubled to about 8.6, and what I hear, the latest is actually it's gone to about 11%. As of May 2010, the latest statistics shows that about 11 to 12% of Singaporeans have got diabetes mellitus, and the numbers are expected to rise.
My goodness, some kind of increase like that in a disease burden for diabetes, that's quite alarming, isn't it, to people in your profession to see those kinds of jumps?
Exactly, because diabetes, when the number of people increase, number of people who have diabetes mellitus increase, that also means that we're going to have more and more patients going to be hospitalized. We're going to have a lot of complications due to diabetes. As we know, diabetes affect the eyes, the kidneys, amputation, nerves. So we've got lots and lots of management, lot of problems. The complications are the one that makes diabetes quite scary, actually.
And is type 2 the more popular, the more common one, actually?
90% of the world population have got type 2 diabetes. Only 10% are affected with type 1.
Right. Talk to me about the difference between short-term and long-term disease burden of this.
The short-term and long-term disease burden of diabetes. Now, the short-term is basically, diabetes is more of a long-term, because once you get diabetes, you have to manage it for lifetime, actually.
Yes.
And those with type 2, the common one, basically they have to take medication for lifetime. There's a lifetime medication if you have type 2 diabetes. You have to remember to take it before your meals, after your meals. And if you have type 1, all the more difficult, because you have to bring your insulin jab wherever you go to.
That's right. And that's a problem for a lot of the management, the control aspects. A lot of people don't tend to stick to their regime very well.
Exactly. And diabetes have this problem because the only problem is not only going hyper, where sugar goes up. Sometimes some of them even have hypo.
Yeah.
That's another problem. So they have to keep on adjusting their medication, their diet. It's become very messy, sometimes very stressful for a diabetic patient to make sure that the sugar level is always within that healthy category.
Right. Every time I talk about diabetes, I always want to mention to my listeners that it's not fighting an uphill battle. There are stages in your life when you could be pre-diabetic, and you can actually turn your risk factor around.
Exactly. You could be. Many people out there like to tell you, please go for a medical checkup to find out if you're pre-diabetic, because pre-diabetic comes under the umbrella of metabolic syndrome.
Yes.
That means you still can do something to reverse your condition, and you can go back to normal stage again.
It doesn't mean you have to become diabetic.
Exactly.
So if somebody does have it, and like we've heard that, for example, the majority of people are type 2 diabetes, what is the management structure and the management approach of diabetes right now?
The basic management approach of diabetes right now, is number 1 is medication. Taking of medication at the correct time throughout the day. Number 2 is counting your carbohydrates intake. Very important. Diabetics must always be careful of how much of carbohydrate they consume. And number 3, the next one is they have to make sure that they follow a regime of exercise. Okay, and of course they have to take care of their glycemic index and glycemic load, because they always thought of fruits which are high glycemic index, avoid rice, potatoes, starch. They taught all of that by the dietitians.
I'm glad you elaborated on that, because a lot of people just think it's sugar, that it's only about sugar, avoiding sugar.
No, it's also a lot of that, like potato and white rice and certain fruits with very high glycemic index, like watermelon is a no, pineapple is a no, mango is a no. So these are all the things that you have to know.
See, that's one thing to change. A lot of people think that it's a natural fruit sugar that suddenly it's okay, but that's not the case. So we know that people have oral medications, insulin injections that happen, things that exercise is critical, you said, because we know that excessive weight gain and obesity is also a risk factor.
Exactly. Yes, because when you exercise, okay, your body uses up glucose, okay,
Yes.
the intake of glucose into the tissues and the cells is better, okay, insulin sensitivity increases, so your blood sugar level is more controlled.
What exactly is the medication doing in your management of diabetes?
Basically, what does the medication do is, some medication, okay, increase the conversion of glucose to glycogen.
Yeah.
Some medication increase the sensitivity of the cells and tissue towards insulin so that they can uptake more glucose. So basically, this is what medications usually do. Some medications slow down the absorption of glucose. Now, all of this which has got one objective: to bring down the blood sugar level.
And that's why it's so essential. Coming up, we're going to find out more. What do you need to know if you have diabetes? We know it's on to becoming the next epidemic, according to the WHO, the World Health Organization. And we know that it affects quite a few people in Singapore. Unfortunately, not enough people know a lot about the management of it. We're talking about how changes in your lifestyle can have an impact on your diabetes mellitus. One thing that can have a management role as well is the actual consumption of chlorella, which is a naturally occurring whole food. It's an algae, and we're here to find out what role that can play when it comes to diabetes as well. My guest is Dr Haresh Kumar, who's from the Faculty of Medicine at Mahsa University College in KL, Malaysia. Give us a ring right now if you have any questions about diabetes and the role that chlorella can play in it. 669-11938. Dr. Haresh, talk to me a little bit about, first of all, remind my listeners, when I say it's a naturally occurring whole food as an algae, a lot of people might think of it, and we said it before, that it's just a vegetable. Let's say it's just something like that. Why is something like chlorella so powerful, really?
Chlorella is so powerful because it's actually the most important thing about chlorella is just very much natural. It's something which is natural and is packed with an array of vitamins, minerals, phytonutrients. You name them, you have them in chlorella. And the best thing is, all these minerals and vitamins and phytonutrients, they are all in a synergistic form in chlorella. So
because it's a natural form.
Natural, they all balance each other. And the best thing is, whenever one consumes chlorella, all these minerals, vitamins and phytonutrients are absorbed very well because it comes in the natural, the organic form. So it's very important. So absorption is there. Once absorption is there, assimilation is there. Once assimilation is there, you see the outcome. You see that positive outcome that you want.
And it's quite easy to consume, so you get everything in a little...
Exactly, it's very simple. All you have to do is just take in the morning and in the evening. Okay, depends on what you understand. People start with 3 tablets in the morning, 3 tablets in the evening, then they slowly go up to 5, slowly go up to 10. Depends on what they want. Of course, therapeutic dosages are higher. Those who have got hypertension or diabetes, maybe they can go up to about 30 tablets a day.
My goodness.
But again, it's all just like eating vegetables, okay, green vegetables, because it's packed with all good stuff inside.
Let's talk about how that good stuff will help somebody with diabetes. We talked about some of the deficiencies that somebody with diabetes has. What role does chlorella have in helping manage that?
Now, basically, the best part about chlorella is, okay, it has got a perfect balance of proteins and carbohydrates, okay, proteins and carbohydrates both, and they nourish the body with a steady energy flow without promoting the secretion of insulin. Okay, so when a diabetic consumes chlorella, okay, there won't be any stress on the beta cells of the pancreas to produce more insulin. Okay, so number one. Number two, okay, chlorella will give them all the nutrients that they need. Okay, so basically it's an appetite suppressant. They won't be craving for food. Now, basically 80% of diabetic patients have got low levels of magnesium. That's why many health practitioners, they always label diabetics as magnesium deficiency state. Okay, so being rich in magnesium, chlorella will help to normalize blood sugar levels. Now the question again is, how come chlorella is high in magnesium?
Yeah.
Remember, because chlorella is full of chlorophyll. Now chlorophyll, the main metal, the main element, okay, in chlorophyll is none other than magnesium. Okay, and another important thing, like to tell all the listeners out there, remember when a person is in diabetic stage, the body is very acidic. So what happens is, chlorella is alkaline.
Right.
So when the person consumes, okay, chlorella, the body slowly shifts, okay, from the unhealthy acidic state, it slowly goes to the healthy alkaline stage.
That is very interesting. Why is your body more acidic if you're a diabetic?
Definitely, because when you're diabetic, you've got lots and lots of free radicals in your body. When there's a lot of free radicals in your body, there's a lot of free radical damage. There's a lot of malone dialdehyde, which is the byproduct of the free radical attack on the cells and tissues. Okay, and one of the consequence, okay, of having a lot of free radicals in the body is the body will become very much acidic.
Yep.
So normally people who have got diabetes, people with cancer, all these people, their bodies are very much acidic. So what is important is chlorella, one thing, rich in magnesium, at the same time is an alkaline stuff that will really help people with diabetics. You can see their sugar level under control. After a few weeks, we can see the results coming in.
We often hear how green leafy vegetables are a good source of alkalinity as well, so this is also present
exactly
in chlorella. We're going to find out more about the role that chlorella can have and the impact it can have on your nutrients levels, your mineral contents in your body, fighting off free radicals, of course, and how this can all help individuals who are actually seeking to control their diet if they have diabetes mellitus. We're continuing just ahead on Body and Soul. This edition of Body and Soul is brought to you by abeilledor Chlorella. Now, for more information, you can call 6339 5045. That's 6339 5045.